Welcome back to our med school. The last session we have discussed about the classification of hypertension, and we have divided the hypertension depending upon the etiology into primary hypertension and secondary hypertension. Today we'll be discussing internal medicine competency 8.5. How will you differentiate primary from secondary hypertension? So let us look into what are the common causes of secondary hypertension. 90 to 95% of hypertension are essential. There is no single etiology is there. Only 5 to 10% are secondary. Of the secondary, the most important cause is renal. Renal disease can be divided into renal parenchymal, that is chronic kidney disease, acute kidney disease, so can be renal parenchymal. Second is renovascular. Renovascular can be fibromuscular dysplasia or it can be renal artery stenosis. The second important cause is endocrine. Among the endocrine, the most important are one is the pheochromocytoma, primary hyperandrogenism, Cushing syndrome, thyroid disorders. Of course, pregnancy-induced hypertension can also be considered. Then drugs are important. The NSAIDs, oral contraceptives, many drugs can produce fluid and water retention and lead on to high blood pressure. Then always remember vascular causes. Among these, the most important thing consider is coarctation. Coarctation should never be missed. It is said that the first case of coarctation is always missed. And once somebody show that if you have missed a coarctation, you will never miss it. So make it a point to examine for radiofrequency delay in all cases of hypertension. So in the examination, not only for the target organ, but also for the etiology, you should think. Then we have mentioned that some of the other clues are these. A primary hypertension usually runs in family. There is a family history there. Then there are risk factors for primary hypertension: sedentary lifestyle, obesity, sleep apnea, and all these things you have to look for. And stress is also another important thing. And in a renal secondary cause, look at the patient for features of endocrine problem. Like Cushing syndrome is taken during inspection, you may be able to identify the moon-shaped face, striae. All these are clues for the. Then drug history is very essential. So the patient is taking steroids. So this may be another reason for high blood pressure. Then response to treatment. The secondary hypertension is often resistant to treatment, and hypertension occurring in the young and older and the elderly or a sudden development of blood pressure. Yet is in the secondary cause. Postural hypertension is also seen in many cases of secondary causes. Then remember, the primary hypertension or the essential one is usually silent. Until target organ damage develops, there is no symptom. That is another important point to be remembered. But whereas in pheochromocytoma, there may be palpitation or there can be episodic hypertension. All these may be there. And in the next session, we'll be discussing on internal medicine competency 8.6. Thank you.